Good afternoon, everyone. This is Angela Marr. I work with the Centers for Disease Control's National Center for Injury Prevention and Control. I am the branch chief for the Program Implementation and Evaluation branch here at CDC. It is a pleasure to be with you here today and to have Diane Colello and Jennifer Fulkenroth both here with us today to present on the Children's Safety Network's electronic cigarette webinar. This is a before I introduce our speakers, Kate Sinclair has a few technical announcements. Kate, you want to go through our technical review?
Yep, here we go. So if you can hear right now, the audio is being broadcast through your speakers. If you experience audio issues, please dial 866-835-7973 and mute your computer speakers. You will be muted throughout the duration of the webinar. You can download today's slides in the resource pod, and the link to Children's Safety Network's new e-cigarette resource guide is also in the link pod next to it. Please use the Q&A pod at the bottom left to ask questions at any time during the webinar of our presenters. And this session is being recorded and will be archived on the Children's Safety Network website. Thank you.
Hello, again, this is Angela Marr. I did want to mention that in addition to working for CDC, I'm also a member of the Children's Safety Network Advisory Committee. And I just want to welcome you here today. We've got some fantastic content lined up. We're going to have time for Q&A at the end. So if you want to type in your questions as we move through today's presentations, we'll have all of those and we can direct them to the appropriate speaker as we get closer to the end. So today I want to start with an introduction of Diane Colello. Dr. Colello is the Executive and Medical Director of the New Jersey Poison Information and Education System in Newark, New Jersey, and an Associate Professor of the Emergency Medicine at Rutgers, New Jersey Medical School. Dr. Colello has presented and published on a variety of topics in clinical toxicology and has a background in epidemiology, health measurement, and database research. Her areas of specific interest include pediatric consequences of the opioid epidemic, public health implications of medicinal and retail cannabis programs, health implications and management of environmental lead poisoning, and public health response and investigation of toxic illness. This includes the most recent outbreak of vaping-associated pulmonary injury, the toxico surveillance for which is being conducted by NJPIES in conjunction with state and federal agencies. Following Dr. Colello, we have Jennifer Fulkenroth. Ms. Fulkenroth is the American Lung Association's National Senior Director for Tobacco Programs, leading efforts nationwide in ending the epidemic of e-cigarette product use among our youth. In 2004, Jennifer started her career at the tobacco treatment specialist and received her certification from the Mayo Clinic in December of 2006. Over the past 15 years, Ms. Fulkenroth has assisted over 1,000 youth and adult tobacco users in successfully breaking free from their lifelong addiction. She is very passionate about developing, implementing, and enhancing the delivery of programs that will ultimately support healthier, tobacco-free lifestyles throughout the communities served. With that, we're going to turn things over to Diane.
Thanks very much, Angela, and thanks to the Children's Safety Network for arranging for this webinar and for the opportunity to speak on something which, honestly, a year ago was something I was concerned about, but has almost taken over our whole operation in the last few months here at the Poison Control Center with the recent outbreak of lung injury. So not a day goes by at this moment that I don't say the words e-cigarette and vaping. And so I'm really happy to be talking to all of you about the Poison Control Center side of things. I will say we have a funny name here in New Jersey. It's the New Jersey Poison Information and Education System, and we say NJPIES. But our term that we use publicly really is the Poison Control Center, and that's because it's what most people recognize. So you'll hear me use those interchangeably during this presentation. I I'm going to provide a bit of an e-cigarette 101. If you haven't vaped yourself or you don't have somebody in your household who's used these devices, you know the general idea, but it can be a little confusing exactly how these things work. I'm going to talk about that a bit. The epidemiology of vaping, in particular as it pertains to children and young adults, and then the health effects with focus on poison exposures, which mostly happens as a result of e-liquid ingestion, and then the current very much ongoing outbreak of e-cigarette vaping product-associated lung injury. First, I have no conflicts of interest to disclose, but I do want to say that a lot of the material you'll see comes from collaboration with other poison centers. I'll talk about poison centers at the very end a bit, but we're a national network of about 55 centers. Each center is a little different in terms of funding and structure, but we are very collaborative. And in this outbreak and others have put our heads together many times to share information. And this presentation is a product of that, as well as working with our own national organization, American Association of Poison Control Centers, that maintains a data dashboard as well as support to all the poison centers nationally. So it's impossible to read the news or turn on the television or even have a conversation, I think, right now without the topic of vaping coming up. And it's clearly a very hot topic now, but the concerns about health effects, be it what does this do long term, or what is happening with this rash of acute lung injury and lung respiratory failure, to what happens when these things explode, has been among us for some time. So e-cigarettes sometimes are referred to as ENDS, or electronic nicotine delivery systems, although as the technology and the human use of these devices evolves, it's clear that it's not just a delivery system for nicotine anymore. They're battery-operated devices that vaporize liquid, either free-base nicotine or nicotine salts, or other things like cannabis or alcohol or ethyl alcohol and other things for inhalation. And they go by a lot of names, whether it's cig-alikes or e-cigs or hookahs or e-pens, vape pens, kind pens. There's a whole lot of different varieties out there. They work by when the user breathes in, that activates the device to release the vapor. And that vapor is created when the battery in this device activates a heating coil. When the liquid comes into contact with the heating coil, it is superheated to the point of producing a vapor aerosol. Now, there are some practices like dripping or dabbing, where just dropping the liquid right onto the heating coil instead of using the device as it's kind of meant to be used can create a much more concentrated vapor aerosol, and can also release some of the other toxic components like the heavy metals that, for example, that are in the heating coil itself. So you should be conscious of those two practices. And then the aerosol is inhaled, and that delivers the drug or the compound to the system via body via inhalation. So the device that has the greatest market share by far is the Juul, which you can see here. It's very popular. It's estimated that 70 to 80% of particularly young adult users use Juul. You can see on the left it looks a bit like a thumb drive, and it's a long rectangular device that does actually insert into, for example, a computer charging port. It's black, it's slim, it can be put into a pocket without being seen. The cartridges insert into the Juul itself, and then it can be inhaled. And these are incredibly popular. It's hard to emphasize that enough. Other devices, though, are available that are in plain sight. So you can see here on the left, the head of a watch can be used as a vaping device, and that's easily, hidden. And these here are two little vaporizers that are the tips of a hoodie drawstring. So there's all manner of innovation, if you will, that happens to create devices which can be kind of hidden and convenient and kind of cool, particularly for young people. So the e-liquid generally, traditionally, has contained liquid nicotine, which people use for both stimulant and depressant properties. So it can provide energy, it is activating, but it's also something people use, for example, to calm their nerves. People go out for a cigarette because they're feeling jittery, and nicotine can help with that. Generally, the nicotine is dissolved in two liquids, which is propylene glycol and vegetable glycerin, which allow it to be inhaled. And then flavoring comes from a number of compounds. One of the things you'll see in the news a lot about is diacetyl, which is a compound that causes lung injury, separate from the current lung injury outbreak. But flavoring comes in a lot of different shapes and sizes and a lot of different chemicals. And then other compounds, for people who are not looking to vaporize nicotine, make their way in, such as components of cannabis. But back to nicotine, just to look at how much nicotine is actually in a regular old combustible cigarette versus e-cigarette liquid. And the short answer is it's all over the map, but there can be really quite a tremendous amount of nicotine in a little bottle of e-liquid, and that's where we get into issues of pediatric safety in young children, for example. So you see on the left, a regular old combustible cigarette, it does vary based on whether it's a light cigarette or, or not one that is light in nicotine, but on average we can say 12 milligrams of nicotine per cigarette. A low-dose e-cigarette liquid will contain 6 milligrams per ml, and in 15 mLs in a bottle would give you 90 milligrams of nicotine in a bottle. Higher dose e-cigarette liquids are much more than that, 36 milligrams per ml or 540 milligrams of nicotine in a bottle. And Juul liquid in those pods has even more nicotine in it. And, a lot of times this is nicotine salt, which is less irritating to inhale, which sounds like it's a good thing, but it's really not, because it means that much higher doses of nicotine can be delivered and tolerated without causing irritation up front. So it allows for much higher dose delivery. When you look at the economics of it, cigarettes are quite a bit cheaper. And here on the right, how much is too much for a baby, or a 10-kilo or 20-pound baby, is really not very much. So a 1.5 milligrams per kilo. So a 20-pound baby, let's just say, is 10 kilograms. So 1.5 milligrams per kilo is potentially a toxic dose. That's 15 milligrams, okay? And if you look at how easy on this chart it would be for a young child to get even just 15 milligrams of nicotine, it's really not very difficult at all. And I'll come back to that in a second. But when you look at the pricing, 3 packets of regular old cigarettes will cost you about $10, and a container of e-liquid, which is not 3 packs, costs up to 9 to 15. So though they're generally comparable, e-liquid is a little bit more expensive. So what about teenagers? How common is it? Are people really using this? I think anybody who has a teenager or preteen living in their house knows that the answer is yes. These products are absolutely being used, and I talk with my own children about this, who I do not believe vape, but have seen it already in their middle school. I don't have high schoolers yet. So this is quite pervasive. The question is how much. This is recently released data from Monitoring the Future. And the number of teens, and that's kids in 12th grade, 10th grade, and 8th grade, who currently vape has doubled in only the last 3 years. So if you look down at the bottom here, where it says ever vaped, in 12th graders, in 2017, that number was 25%. People who vaped in the last 30 days was 11%. Fast forward to 2019, 25 has gone to 40, and past 30 days has jumped to 25. So that's in your high school seniors. What about in the 8th graders? Again, double. ever vaped, 10 to 20%. And in the past 30 days, it's 3.5 to 9%. So these numbers are going up and up without question. Also, the use of e-cigarettes increases the likelihood quite significantly that an adolescent will transition to combustible cigarettes, so cigarettes to cigars and hookah. So in contrast to the somewhat commonly held dictum that e-cigarettes prevent people from smoking cigarettes, in teenagers it actually seems like it really does increase their likelihood of doing so. So 8.1% of teens who have never used an e-cigarette start smoking within 6 months of the survey, whereas that number is 30.7% in the kids who use e-cigarettes. So it's definitely increasing the likelihood that they will either switch to cigarettes or will or smoke both. When you look at the prevalence in teens of cigarette use, it's gone down. So you can see the navy blue line at the top is 12th graders. And since 1976 through to the kind of present day of 2018, the number of kids who smoke cigarettes has gone down. A little bit of an increase in the 90s and early 2000s, but it's generally gone down. Same with 10th graders. That's the yellow line, and 8th graders. The superimposed red line is the bad news, which is vaping by high school 12th graders. And that has completely eclipsed the rate of cigarette smoking in that group far and away. So teens aren't really smoking cigarettes, but they are vaping, and then in so doing, many of them end up transitioning to also smoking cigarettes. Just one word about the success of tobacco cessation with e-cigarettes. They're frequently marketed for smoking cessation. They are not an FDA-approved method of causing smoking cessation, and the data, I think, is still mixed. This is the results of a meta-analysis which combined a lot of studies looking at the odds of quitting smoking. And you can see that the majority of these studies fall to the left side of that line, not the right, suggesting a lower likelihood of tobacco cessation with e-cigarette use. Now, this isn't in adolescents, this is in all comers, but really does and should cast doubt on how effective e-cigarettes are actually at causing sustained tobacco cessation. Now, flavoring is a wholly different consideration, but one that's often talked about when we think about how can we devise a regulatory solution to keeping kids safe from vaping and stopping nicotine initiation by children. And it is because a lot of the flavors that are available just are appealing to kids. And although you can always hear from or find an adult who was a 3-pack-a-day smoker who now only uses strawberry-flavored vapes, it's very clear that pediatric patients prefer sweet-flavored vapes and mint-flavored vapes. So this is a study published last month, again using large data, looking at the flavors of e-cigarettes used by youth. On the left is 8th grade students, in whom you can see mango and fruit flavoring is the most popular, and that is followed by mint. I'm sorry, I'm just trying to pull my arrow down here. My arrow's not cooperating. All right. But you can see fruit and mango is much more popular in the 8th grade. In the 10th grade, those numbers go down just a little bit. And then, oh, there's the arrow. So you can see mango and fruit go down a little bit, and mint increases. And then in the 12th grade, the fruit and mango still second most popular, but mint has now become the predominant favorite. What I think this means is that kids initiate with the sweeter flavors and transition to mint. And a lot of the talk about what flavors should we really target for either banning outright or at least tighter regulation, it's fruit and mint, and this is the reason why. This is a graphical depiction of a similar thing. So in high school students, the I still can't get my arrow to work again. In high school students, you can see that orange line is the fruit flavors, and that's fruit and mango. And it is very popular, but creeping up here is menthol and mint, which then becomes almost as popular. This is a slightly different study than the previous slide. But in middle school students, it's definitely fruit, menthol. This black line is candy, desserts, or other sweets, and mint. So kids are not really using tobacco-flavored vape nearly as much as they're using the things that you would consider most enticing. This is a little bit older data looking at prevalence, which we know is higher now in 8th, 10th, and 12th graders. But I just want to draw your attention over to the right side of the slide, which is what do teens say they are vaping? So I think the majority start out either vaping nicotine or vaping just flavoring. But a lot do vape other things, including this marijuana or hash oil. And that is where I think a lot of the issues surrounding the acute lung injury outbreak have arisen surrounding marijuana extract vaping oil, vape oil. Okay. A lot of things can be vaped. So ethanol can be vaped, and that basically gives you the intoxication without the calories of consumption. THC is the psychoactive component of cannabis, and CBD is another compound found in the cannabis plant that has other properties, including some sedation and pain relief. Those are common, popular vapes. Synthetic cannabinoids, a much more dangerous class of drugs, meant to kind of mimic the effects of cannabis, but are very impossible to predict the effects, have been vaped. Fentanyl and other opioids have made it into vaping juice, and then other novel psychoactive substances, stimulants, hallucinogens. I even got a question the other day about can you vape melatonin. So I think there's a lot of creativity going into the things that people are trying to vaporize. Just one word about what's actually in e-cigarette aerosol. So I think even if it does not contain nicotine or contain some toxic compound that's causing lung injury, it's not just water vapor. There's a lot in there that's chemical or metal. So heavy metals can make it into aerosol because of the heating coil. And that includes things like lead and nickel and chromium, which we know are really bad for your health. Flavoring. So I mentioned diacetyl. Diacetyl is linked to an occupational disease called popcorn lung, which is something we see in workers of microwave popcorn facilities, but it's also in vaping flavoring. Menthol obviously is associated with the menthol flavor, eugenol, limonene. These are all pretty toxic when inhaled. Formaldehyde's a carcinogen, and propylene glycol and glycerol are also in e-cigarette aerosol, but are generally inert and is what is used to dissolve the active component like nicotine. So this is kind of what's found in that big cloud that, you know, looks maybe to the uninitiated user like it's just water vapor and whatever they're trying to inhale, but there's actually quite a bit in there. So let's talk about health effects. I'm going to focus on the first two of these, which is poisoning exposures. You know, what happens, for example, when a young child gets into e-liquid, and then the outbreak of EVALI. So the American Association of Poison Control Centers have been monitoring calls about e-cigarette and liquid nicotine products since 2011, which roughly corresponds with the initial period of these products hitting the market. As of November of this year, poison centers have managed 4,700 exposure cases in this year alone. And you can see here's the data since 2013, in which cases went up and then fell a bit and now are higher than ever before. I think what may have gone into this rise and then fall is a lot of poison prevention packaging regulation. In 2015, the Child Nicotine Poison Prevention Act was passed, which requires things like child-resistant packaging on e-liquid and that kind of thing. So although I don't know for sure, I suspect that some of the fall happened with that. We see that over and over in poison control, actually. When you package something with a mind on prevention, you do save people from being poisoned. So what happens in nicotine poisoning? It can occur via most routes of ingestion. Prior to the e-liquid and e-cigarette explosion, if you will, we mostly took calls about kids who ate cigarettes. But even one cigarette has enough nicotine to send a young child to the hospital. And when you look at the concentration of e-liquid, you can see actually you could get a very bad and tragic outcome from drinking e-liquid, and that has been reported. Fatal overdoses have been reported in the medical literature from 18-month-old children, for example, who drink e-liquid. And you can see how it's a setup if the liquid tastes like fruit or, bubble gum or something. Nicotine poisoning starts early, and initially after ingestion we see nausea and vomiting, stomach pain, drooling, increased heart rate, headache, dizziness, and which then progresses to diarrhea, shallow breathing, lowered blood pressure, and the thing that I think is the most life-threatening is we see seizures, inability to control muscle movement, and that is also inability to control the movements required to breathe, and respiratory failure as a result. So this is absolutely a life-threatening poisoning in a child in particular, or really anybody who gets too much nicotine by weight. So how much is too much? So I told you 1.5 milligrams per kilo, roughly, is enough to cause severe toxicity in a child. So per kilo, I know most people don't think in kilograms. I'll tell you for a 20-pound 1-year-old or 2-year-old, that's 15 milligrams. And if you look here at the different nicotine concentrations, so this is the low dose e-cigarette liquid. Getting up here is the higher dose e-cigarette liquid, and they can be even higher than that. We know that children, when they ingest something, they take in anywhere from 5 to 15 mLs and maybe even 30. So it's basically anywhere from a teaspoon to 2 tablespoons. If you look at 5 mLs, even of the low dose e-liquid, that's 30 milligrams of nicotine. And that's well over that 15 milligrams. You fast forward to a higher dose product, and that's 120 milligrams. It's not hard to see how this could easily result in a tragedy from just a quick drink of a fruit or Sprite or something sweet flavored liquid. Now, to switch gears a bit, let's talk about EVALI. So back over the summer, I would say I read in the news about this piece on the left, the 8 Wisconsin teens. That's the first I kind of became aware of it. It was in July. We were having a conference here at the Poison Center, and I usually put up current events, and I put this up on the screen and said, look at this, these are healthy teenagers who are coming in with extremely low oxygen levels. They get admitted to the ICU. They get put on a ventilator. This is serious business. What the heck is going on here, And we started to get calls from hospitals or colleagues in the state saying, I just had one of those cases of the kid with the vaping, and now they're in the ICU, and I'm not sure they're going to make it. And poison centers across the country, I think, started to connect the dots and put out, we put out something to the hospitals in the state saying, we're seeing something weird. You wouldn't expect this from just e-cigarette use, even though it's not necessarily good for your lungs. You don't see people just drop with their lungs just completely giving out. Something is going on. And it's obviously become clear now since July that we're in the midst of a major outbreak. Soon after Poison Centers put out their alerts, I think we were joined by all of the surveillance agencies. CDC launched the investigation, departments of health. I'm happy to say the New Jersey Poison Center is the point of contact for our own State Department of Health to conduct surveillance and try to collect data, which we still need because there's a lot of questions that remain. So this is the number of lung injury cases as of last week. There's over 2,400 cases, over 40 fatalities. It's now affected every state. And you can see our little state of New Jersey. We've had between 50 and 100 cases reported. Although I think there are many more. I think patients may have mild symptoms that don't come to medical care that may make them stop vaping, and we don't hear about all of them. Capturing all the cases is challenging, but this is the general shape of the outbreak. Symptoms initially actually are GI, so nausea, vomiting, abdominal pain, fever and fatigue, shortness of breath, and chest pain. Generally, patients don't have symptoms of a cold. They don't have a runny nose, for example, but they do have a lot of overlap with flu symptoms, and I think things are about to get a lot more complicated as we enter flu season, because a lot of people vape and a lot of people get flu, and figuring out who's got vaping-associated pulmonary injury is getting harder. Findings are low oxygen, high heart rate. Listening to the lungs may not reveal very much. X-ray and CAT scan often shows bilateral ground glass opacity, so that's basically a haziness that affects all of the lung fields. And peripheral sparing, I'll show you a picture of in a second. There's a white blood cell count. The white blood cell count is generally elevated. That's leukocytosis. Elevation in inflammatory markers like the ESR and liver enzymes, AST and ALT, also are elevated. As for treatment, we're mostly giving oxygen, supporting the patient. If they need a ventilator, they go on that. If they need ECMO or bypass, that has been necessary and has happened in some cases. There's a report of lung transplantation happening as well. And steroids seem helpful, although there's no clear indication of how much or how we should be giving it. So we're recommending steroids and essentially supportive care. So why is this happening? There are a lot of theories, and there's a lot of different patterns of lung injury. Lipoid pneumonia is essentially what happens when you get fat into your lungs, and sometimes that is seen on pathology investigation. Hypersensitivity is basically allergic reaction in the lungs, and then the direct toxic effect of different chemicals has been reported. And the one that's certainly risen to the top attention-wise is vitamin E acetate, which I think is certainly one of the things responsible, but probably is not responsible in every single case. Looking at the results that have come out so far from samples both from patients as well as actual vaping liquid that's been analyzed by the FDA, the majority do contain THC, and that's the cannabis constituent. And of the THC-containing products, many do contain vitamin E acetate, but they also contain other oils, medium-chain triglycerides, baby oil, you name it. So a lot is cannabis. This product, the dank vapes, has been implicated a lot. They're not the only one, but this is THC vape oil. And soon after the outbreak kind of started to take shape, this news piece at the New York Times of these brothers who basically had a large-scale operation in their house where they would buy many, many, many empty cartridges, make THC vape oil, fill it, and sell it. And this is known as a pen factory. These cartridges are available everywhere, eBay, Alibaba, other e-commerce sites. And we refer to them as black market, but I guess if THC is legal in the state, they're not necessarily totally illegal, but it's informal market. It's basically the stuff that happens when people make things in their basement. Just a word about how does THC actually get into the oil. So anytime you want to get THC, which is a plant product, or nicotine, which is a plant product, into a concentrated liquid, you soak it in liquid. And for nicotine liquid, like the Juul pods, that's things like propylene glycol and glycerol. For medical marijuana concentrates, like the state-sponsored dispensary product, that's usually also propylene glycol and glycerol. But if you're doing this in your house or basement or someplace on the informal market without any regulation, you could soak it in anything. So we have a problem sometimes with cannabis where it's soaked in butane to create a product called butane hash oil, which is not vaped. But you soak it in butane or propane, you allow the cannabis constituent to kind of go to the bottom of the column, and you can see that here. It drips to the bottom of the column, then you heat that column until it's the liquid in it is very concentrated in this trough. Now, as you can imagine, butane is highly flammable. Sometimes things explode. But this is the principle by which any THC or anything really is extracted into an oil. And I suspect that what's happening with EVALI is whatever the choice of that oil is to extract is what is causing lung injury. And in some cases, that is vitamin E acetate. So the CDC guidance right now, I mean, I think we would all like it if it was just don't vape, stop vaping. And we're trying that, but there's a lot of people who do. And, you know, for whom that is a, you know, addiction or, you know, something that's much harder to stop than just saying don't do it. CDC recommends people don't use THC-containing products. Vitamin E is definitely of concern, but it's probably not the only answer. E-cigarettes should not be used by youths, young adults, or women who are pregnant. And adults who are currently smokers should not start using e-cigarette or vaping products because all tobacco products carry a risk, and just adding another one is not going to help. In conclusion, just a few words about poison centers. We are a national network, 24/7 phone hotline available to anybody who calls. We have a national hotline. We serve all 50 states and territories. Phones are answered by a healthcare professional, nurse, pharmacist, doctor. There is no copay. There is no phone tree. You call and you get help. And many poison centers, not just ours, are the point of contact for EVALI surveillance, for departments of health, as well as the CDC. We feed our data into a national poison data system, which uploads to our national server and communicates with organizations like the CDC, the FDA, Homeland Security, every 8 minutes. It's a powerful early warning system for natural and man-made toxic threats. An annual report is published summarizing toxic exposures. Tailored reports are available, and there is a data dashboard right online on the website where you can look at things like how many cases have been reported of vaping lung injury. Poison centers serve a valuable role in many arenas. We are cost-effective. We have real-time data surveillance. We serve special populations regardless of language or hearing ability, you know, age range. We are accessible, we're open and free. And we conduct a lot of education. As I think a lot of people on this call know, we have a robust staff of educators who go out into the community and talk to people about hazards just like this one. Our poison center is no exception. Here is our website. You can find actually quite a lot of information on www.njpies.org about vaping, as well as on the AAPCC website. So although I know this slide says questions, we're going to take questions at the end. And I thank you very much for your attention. And I'm going to pass the microphone, the virtual microphone, to Jennifer Folkenroth, who's going to tell us how the way forward to get out of this. Thanks very much.
Thank you so much, Diane, and hello, everyone. Extending my greatest thanks to the Children's Safety Network for inviting the American Lung Association on today's webinar to talk about effective strategies to prevent youth e-cigarette use. It's absolutely a privilege to connect with you all as we really can partner together and address this extremely concerning epidemic among our youth. I will work today to really help reveal some resources and strategies that you can use out in the communities that you serve to really make a difference. I fully disclose I am very passionate about this group that I'm speaking with today. I am a past Safe Kids Coalition member from Pennsylvania and nationwide trainer for integrating tobacco cessation intervention and cessation delivery services within maternal and parent health services, both clinical and community-based, with a passion that has fortunately been fed for over 15 years in prevention and cessation work, on top of course, being a mother of two very energetic boys, ages 2 and 5. So you can imagine the opportunity to connect with you today is a great opportunity. So in our time together, we are going to be talking a little bit more about how you can gather tools and resources to address e-cigarette use among a variety of different target populations that you may be working with day to day. This includes teens, parents, schools, within the healthcare setting, community settings, and unfortunately, if you are to find those teens who have become hooked and addicted to these tobacco products, how can you connect them with cessation services to directly address e-cigarette use and really help navigate them to breaking free from their addiction? And then I'm just going to summarize with a recap of where you can find all of the great resources we're going to review. The American Lung Association is committed to helping educate, intervene, and prevent the use of tobacco and nicotine by the next generation. This is especially important because close to 95% of tobacco users try their first product before the age of 21. And with the FDA's announcement about teen vaping reaching epidemic levels, the fight against nicotine and tobacco has become even more vital. Keeping youth from starting is critical, and they desperately need your help. So we'll first go ahead and start with the teens, the users, right? So what we have found first and foremost is it's really important to make sure that teens are educated that these are in fact tobacco products, just in fancy new disguises. And even those that say they're nicotine-free, most, in fact, do contain nicotine. It's not just simply, harmless water vapor. That is a very common misconception among today's adolescents. And as you know, nicotine is a highly addictive, chemical that when exposed during the adolescence can really harm the development, of the brain. So teens are directly targeted by the tobacco industry through various marketing tactics to really hook this next generation on their new products. And the whole purpose is for these teens of today to serve as replacement customers for those buyers that are lost every single day because of using these deadly products. American Lung Association has launched the True Vape Talk, and I have provided the URL here at the bottom of the screen. So this really helps to counter that tobacco industry manipulating, our youth through their marketing tactics by providing a true conversation with the teen, a resource that really can review for them, what are these products, what's in them, what are they really doing to the teen's body? What are the big tobacco companies doing to manipulate them to become their next replacement customers? And we also have included a quiz where teens can go on and determine whether or not they are addicted to these products, through a short assessment. So this is certainly a resource available to all of you, in addition to a variety of different one-pagers available through lung.org that I would encourage you all to explore. In addition, through American Lung Association's research, we have really found through key informant interviews, focus groups, program piloting across the nation, that the most powerful strategy for evoking change in adolescents is to share testimonials from their peers. It's one thing for mom and dad to say something, right? But it's another thing for them to hear from third-party peers that are their age, what they have experienced. So you can see here, the FDA had launched the Real Cost campaign, and I have to say that this campaign has been incredibly successful in really bringing this epidemic to the forefront, as well as just helping to voice what teens are feeling about the addiction to these newly disguised tobacco products. I put a couple quotes on here that tend to hit home with me particularly, but of course, sharing these with other teens and having them share stories about their addiction to these products and their journey to freedom is incredibly empowering among our youth. When talking to parents, so it's so very important that we work with parents. Parents, although met with resistance many times by the teens, make a resonating impact on young minds. So the American Lung Association hosts several resources on lung.org, including one-pagers about what parents should know about. In addition to understanding the products, it's also really important that you break down two barriers specifically with these parents. So before really providing them with the resources, it's really important to address two key issues. The first is the parental belief that e-cigarette products are not tobacco products and not harmful. You know, it's really important that you address that these are in fact tobacco products and it can be incredibly harmful to the teens. You know, driving that message home that they are tobacco products has really, you know, set off a light bulb, you know, and said, oh, okay, you know, now I've increased my perception of risk and association of classification of these products, you know, where I had them first in my mind, and now understand the importance in addressing with my kids. The second part is the parents' belief that their kids are not at risk because they don't fit the mold of what a tobacco user looks like. Over the last 20 years, we have seen an evolution of this teen tobacco user persona. So, you know, 20 years ago, you know, as a tobacco user, you really were looking at being, you know, the rebel. Today, the typical teen e-cigarette user really better associates themselves as aspirational, athletic, and college-driven. A complete turnaround from what we have experienced over 20 years and much longer before. So it is important to really dispel this myth among parents so that they can address it right up front so they're not negating that conversation by saying, this doesn't apply to my kid because my kid isn't a rebel. They're college-driven. Well, you know, that unfortunately is the kids we're working with today. To help with this conversation, the American Lung Association launched the Vape Talk. This includes a downloadable parent conversation guide, tools, tips on what you need to know, and really research and evidence-based strategies that we have tested in the field to make the largest impact through that conversation. So I encourage all of you to visit thevapetalk.org and access this parent conversation guide to really have these important conversations at home. In addition, you know, we know that those parents who are tobacco users directly impact the, you know, the possibility of the initiation of tobacco products among their kids. So we also want to encourage those parents who may be current tobacco users, including current e-cigarette users, that in fact if they are seeking to quit, if they truly want to quit their addiction, to really seek out those that are proven safe and effective, those strategies. So American Lung Association also launched a campaign called Quit, Don't Switch. This all is about countering the false cessation claim ads from e-cigarette companies and really saying that their, you know, product, their tobacco product is a method of cessation, which, you know, is not the case. FDA has not found any e-cigarette product to be safe and effective in helping individuals to quit. So this campaign really helps to steer those individuals who are interested in quitting to those methods that are safe and effective. And what is most safe and effective is medication plus counseling. When addressing it in schools, so the American Lung Association has a variety of different programs, but one of the most comprehensive ways that a school can address this e-cigarette epidemic is to make sure that a comprehensive tobacco policy is in place, prevention education, awareness campaign, and intervention, as well as cessation and advocacy efforts. That is a way that you can provide a comprehensive approach to changing the public health. If you go on to lung.org, you will be able to download our tobacco-free campus policy. This really helps to guide you in what makes a comprehensive policy. What does that language look like? What does the enforcement of that policy, you know, entail? So I would encourage all of you to utilize this resource as well. And of course, we talked about the True Vape Talk. This works just as great for schools when it comes to addressing with teens and really helping to navigate that conversation. American Lung Association also has an alternative suspension or citation program that was released in September of this year. We currently have over 400 certified facilitators across the nation offering this. So it is facilitator-led. We have piloted in 11 schools, community-based agencies across the country, and the result was 60% of students participating reported that they were willing to quit their e-cigarettes after completing the program. This alternative suspension facilitator training is available at no cost to you by visiting lung.org/in-depth, and I would highly encourage you all to take advantage of this free training opportunity. For the cessation piece, we do have Not on Tobacco. So Not on Tobacco is an evidence-based program, and it really provides a group approach. So, unlike, your text programs and others, this one will actually give that peer-to-peer education. Again, another facilitator training available through the association. And then, of course, advocacy and youth empowerment. So, there are local initiatives that you can get teens involved in, or you could start one up at your own, state. But I did provide some information on some youth empowerment, programs that really can help support tobacco-free communities. For healthcare settings, we also have a guidance for healthcare providers that you can visit on our website. And of course, we are partnering with the American Academy of Pediatrics right now to help provide guidance to pediatricians across the nation on really helping to address the e-cigarette epidemic. The key takeaways are really the importance of screening as well as using the Ask, Advise, Refer. When it comes to community settings, it's all about policy. So American Lung Association has a bold plan in ending the epidemic through a variety of different policy efforts that you can contribute towards. Those including e-cigarette, in all state laws, taxes on e-cigarettes, investing in prevention program efforts, federal and state really looking at the tobacco user and helping them to quit. Minimum age to 21, so increasing tobacco sales to the age of 21, removing those flavors, really prohibiting online sales and stop the misleading health claims, as well as ending these coupons. And of course, with that advertising continuing through and the track and trace, there's a lot that the FDA really could be doing to make a difference towards this epidemic. Both clinical and community strategies absolutely are effective on all levels. And, advocating to protect children from e-cigarettes within your health systems, your community, your state, the federal level, they all make a tremendous difference. We do have guidance on e-cigarette, really helping to navigate that among teens, another one-pager available on our website. So please come on over, visit us at lung.org/e-cigarettes for free downloadable resources, facilitator trainings available in English and Spanish, and please never hesitate to reach out to us anytime we can really help assist you in what you do. Thank you so much for the opportunity to connect with you. Together we truly make a difference. I'm going to go ahead and hand it back over to the moderator for questions. Thank you all so much for having me today.
Excellent. So once again, we would like to thank our fantastic speakers, Diane Colello and Jennifer Fulkenroth, today for their presentations. I know we all learned a lot more about the crisis as well as the fantastic positive approaches we can take to addressing this public health issue. I'd also like to thank Cindy Rogers and all of the Children's Safety Network for hosting this webinar today. And I want to remind everyone, questions have been coming in during the presentations, but you can enter questions into the box over in the bottom left of your screen, and then we'll be able to read the questions here and do Q&A from now through the close of the hour. So I'm going to start off. This one looks like maybe it's meant for Jennifer. The American Lung Association Alternative Suspension Program. Is this a training to be delivered just at schools, or can community-based agencies get involved and offer the program to multiple school districts?
That's an excellent question. Thank you so much for asking. So I'm happy to announce that the in-depth program, the Alternative to Suspension program, is incredibly effective. We've seen through our pilot both school-based as well as community-based. So for those individuals who have a community-based agency and may be able to host it for local school districts to refer students into, we've seen great success with that, as well as partnering with the magistrate.
Jennifer. Here's one that looks like Diane. This would be great for you to weigh in on, or if there's anything to add in, please, I encourage both presenters to do so. I understand that the lingo surrounding e-cigarette product use is ever-changing, but I'd love to hear what lingo the kids are using today. What terms have you heard them calling it, and does it vary by region of the country?
That's a great question, and I will say I feel hopelessly square every time we have these conversations, because just when I feel like I've figured it out, it's different. There's a lot of puns on the Juul device, and kids actually do, instead of say vaping, a lot of times say juuling. I mentioned the dripping and dabbing, but please, Jennifer, jump in if you can think of others.
Absolutely. So, here now I'm calling in from Pennsylvania, but nationwide I've been hearing this consistently both in our Western Division and Eastern Division that, many times they would actually refer off of the cart. So I've heard a lot like, where's my cart? A lot of teens are using tricky verbiage that they can say on the cell phone to their friend while their parents are still in the room and not making that connection. So the most popular recently I've heard is, where's my cart or where's my pen? So cart and pen have been the most popular that I've heard most recently.
Excellent. Diane, this may be best for you, but again, hop in as we need to. What are the poison symptoms for vaping marijuana, and are they different from e-cigarettes?
Yeah, so the effects you would expect to see from vaping marijuana are the same you would expect to see from inhaling marijuana, and to a lesser extent from marijuana edibles. So the two primary components of marijuana that cause effects are THC, and that gives you all the things people are kind of looking for, that feeling of euphoria or a high, relaxation. It's also what causes hunger. That's what people are looking for when they smoke pot, and THC is also very prevalent in vape, and that's what people are looking for when they vape THC. CBD is the other alkaloid that I mentioned, which causes sedation. People sometimes use it for pain control. It can be used to control seizures in children. So people don't generally recreationally use CBD as much as they do THC. So if you kind of vape or inhale THC in a kind of a regular dose, if you will, you feel relaxed, you feel a little high. But if you get too much, you feel paranoid, you feel panicked, your heart races. You may have a seizure, and you can become agitated and delirious. And so people who get too much THC, whether it's just unusually strong pot or they vape, an unusually high concentration of THC, can have all of that: seizures, agitation, heart racing or tachycardia, and I would say panic and anxiety are the most common signs we see.
Diane. So Jennifer, are non-tobacco nicotine pouches a reasonable cessation tool? Are they carcinogenic?
The nicotine replacement therapy that's FDA approved and regulated and proven safe and effective for cessation as one of the 7 first-line medications is absolutely safe and effective. However, when it comes to e-cigarette products, FDA has deemed no e-cigarette product safe and effective in helping individuals to quit. If anything, we've actually seen those individuals who have used them to attempt to quit become dual users. Over 50% of them continue to still use the traditional tobacco product, combustible tobacco product, in addition to the e-cigarette. So my best advice would be go for those 7 first-line medications that are proven safe and effective through the FDA.
Excellent. So it looks like we are just about at time. Maybe we've got one more question for either presenter. We have a question from the group that says, I know a patient who vapes CBD oils. Is this harmful?
I think, this is Diane, I think until we know the contents of that oil, and maybe the CBD compound itself is probably fine to inhale, but the liquid or the oil or the solvent that it's in is all over the map. And I would not say it is safe to vape that until we get a much tighter handle on exactly what's causing this lung injury, because right now I think there are a lot of varied products out there. And while CBD itself is not that harmful, whatever it's in really could be.
Well, thanks again to our presenters and to all of you for joining us here today. I am going to remind everybody, please do complete, there's a quick evaluation in today's session. The link is right here on the slide, so we'd really appreciate your feedback on the evaluation, and we are right at the close of the hour. Thanks again to the Children's Safety Network.